Hi, my name is Kathy Pierce. I'm the Director of Floyd Behavioral Health, which is a part of Floyd Medical Center. We're a 53-bed facility, and we treat geriatric psych patients as well as adult psych and chemical dependency patients. We have a West unit which treats our geriatric patients, and we have 23 beds on that side. We have the East unit which treats adult psychiatric patients and chemical dependency patients, and we have 30 beds on that side. We do inpatient services here as well as outpatient services. Our intensive outpatient services are where the patients come in daily, and they are involved in groups and have a counselor that works with them and does individual and family therapy while they are doing the intensive outpatient program. When you come in the doors at Floyd Behavioral Health, you'll be met by our receptionist, and she will take your name and any paperwork, and then we'll direct you to our clerk in the registration department. If you'll come with me, I'll show you where you will go from here. Your next stop at Behavioral Health will be in the registration department, where you will meet the clerk, and she will be asking you specific information. She'll ask your name, your date of birth, and your address. She will also review at that time the type of insurance you have or whatever benefits that you may have. And then you'll be escorted down to the unit, and you will learn more about the rest of your care at that point. The staff members we have here include physicians, nurses, mental health techs, our counseling department. The mental health techs are the ones that are out there with the patients, working with them. We all do groups. The nurses may do education groups. The techs will do groups that are about stress and anger, or a community meeting, what are your goals for the day. This is our geriatric unit, which is called our West unit. On this unit we have a charge nurse, and we have several nurses that are assigned to the patients. They're the ones responsible for giving the patients medication, as well as monitoring their medical condition and their behavioral status. The unit secretary also is the one that answers the phone, and she's the one that's responsible for placing the physician orders in the computer. We see patients anywhere from 5 to 7 days. We may send them home quicker than that, or we may keep them a little bit longer. But we're very short term. We see a lot of patients that come from the nursing home and then return to the nursing home. Some that come from home, and that we do assist with placement. Our discharge planners assist with that placement. We also, with our patients that are having problems with chemical dependency, our discharge planners do assist with getting them in a long-term treatment program. This is the adult psych chemical dependency unit, which is called our East unit. On this unit, again, we have charge nurses and nurses that are assigned patients that will be monitoring the patients throughout the day, giving them medications, and also carrying out the physician orders. We have a unit secretary that will be taking off the orders, and we're making sure they're put in the computer. Our patients' records are on the electronic medical record system. We are also in the process of having computerized physician order entry. The counseling department does individual and family sessions with the patients on our inpatient unit as well. We have an LPC that manages the department, and then the rest of our staff in there are LAPCs, which is a licensed associate professional counselor.
Hi, my name is Minta Knight. I'm the counseling manager here at Floyd Behavioral Health. The counseling department, we do an intensive outpatient program that runs 14 groups a week, and it's for patients who have either been in our inpatient unit and they're stepping down to a lower level of care, or they're patients who not quite need to go inpatient, and we can kind of give them more intensive therapy in a kind of a controlled environment. In the counseling department, we also do groups down on the unit. We have an East unit, we have a West unit. The East unit is adult mental health and substance abuse, and the West unit is our geriatric unit. We do one group a day with them, dealing with different issues.
Every day is different. You're dealing with different patients, different issues. It's exciting because there's so many more medications that are available now that were not available when I first started. The stigma, of course, that was associated early on with mental health, I think we're getting away from that. So the treatment is better, people are more aware, and so it's just been an interesting career for me, and there's a lot that you can do as you work in the mental health career.